Lockdown has affected all of us, but for people who are already struggling with alcohol problems, it's been particularly tough. Stress and social isolation have made matters worse, and for some, it has meant that by the time they actually go and seek help, they're already seriously ill. Dr. Richard Aspinall is a consultant hepatologist at the Queen Alexandra Hospital in Portsmouth and joins me on the show now. Richard, good morning to you.
Good morning.
Extraordinary times, hard to pick through the data. We seem to get different waves of data. Some people stopping drinking, surprising the statisticians, and other people finding it hard. What are you finding?
Well, we see, certainly in the part of the hospital that I work in, we mainly deal with people with advanced liver disease due to alcohol. And certainly during the first lockdown in the spring, we had, if anything, a fall in our admissions during the lockdown itself. But that was very quickly followed by a huge sort of rebound increase as lockdown lifted, because often there's a delay in the health consequences. You know, it takes you several weeks to get very severe liver damage. And our numbers of inpatients with very advanced liver disease due to alcohol more than doubled over the summer. It's kind of too early yet to see the effects of the current lockdown. But that seems to be a very real phenomenon.
Is liver disease something that can be brought on quite quickly by excessive and dangerous drinking? Or is it a very slow creeping shadow of an illness that then suddenly has a spike?
It can be either, to be honest. A lot of people can have a very subtle, difficult to detect form of liver disease in the background, and then if you rapidly increase your drinking over a short period of time, that can then precipitate jaundice where you turn yellow, or certain other complications that then become very obvious. So it's usually a long-term issue, but there can be short-term hazards as well.
Did you find that patients coming in had held back because of everything we've been through with COVID and actually potentially have caused more damage because they've left it too late?
I think so, yeah, particularly during lockdown one, where there was very much a perception that people, didn't want to trouble the health service because there was a feeling that we were overwhelmed with COVID and often didn't seek help, even when services were available. I think we certainly saw a lot of people with nutritional problems, which was quite a new thing for us, where as well as people who were very dependent on alcohol consuming more, they were probably not looking after their health in other ways, so not eating well and deteriorating as a result. And I think had lost a lot of the community contacts that people have, just checking on your friends and neighbours, making sure they're okay. I think we'd lost a lot of that early warning, if you like, of deterioration.
Yeah, the network that's there. And I imagine this particular illness, if caused by drinking, comes with a bit of social stigma as well.
It does, sadly, and that can sometimes deter people. But I would certainly encourage people that if you are worried about a friend or a relative, that there are really good community and hospital services across Hampshire for people with alcohol problems. As well as that, that there are very good sources of information on the internet. There's Hampshire Inclusion Recovery, which is the main provider of help for people with alcohol problems. And they have a very good website and good phone lines to contact.
It's because before you go, Richard, is there a point with the disease, like a liver disease caused by excessive drinking, that it can't be repaired? Or a bit like we often hear with lungs, don't we? We hear the constant positive message that give up smoking as soon as you can because lungs are very resilient. And that's been often the message that we've heard from experts. Is it the same with our livers and our kidneys?
Yeah, to some extent, in that if even at the most advanced stages of alcohol-related liver disease, your liver is very resilient, has great powers of recovery, and while eventually that will be impaired as well, it is always worth getting help, always worth cutting down or stopping if you're starting to get health consequences. And I'd say there is very good help available.
Lovely. That's Dr. Richard Aspinall, consultant hepatologist at the Queen Alexandra Hospital in Portsmouth. Listening to that is Dr. Matt Parker, an expert in neuroscience at the University of Portsmouth. He's called on the government to offer more support to people at risk of alcohol harm during the lockdown. Matt, good morning.
Good morning.
What more could the government do?
Well, I think the response after the first lockdown, really in this second lockdown, seems to have been rather muted from the government. I know they've banned collection of alcohol from premises and so on, but actually home delivery and so on is still okay. And actually, we don't have any data really, or very sparse data, about the impact of home drinking. So, in other words, the changes in habits when people drink at home rather than going out. And listening to what Dr. Aspinall was saying there about the number of hospital admissions, I think that really kind of drives the point home that at the moment there does seem to be this potential for people drinking more and hazardously whilst at home. So I think I certainly would think that the government should take this into account when considering things like home deliveries of alcohol and off licences being essential services, for example.
Is it something that you've been able to predict or follow? Because I know you said the data is hard to track, and of course it is, because everyone's in their own homes and no one's filling out survey data that robustly on how much they're drinking. But is there a particular group of people that are more vulnerable, or does it depend what you do, or is it not quite that precise?
We have carried out various different surveys, and actually there's been some sort of large-scale national surveys on this, so we are starting to get some data in. These data haven't specifically looked at home versus non-home drinking, so that would be a more kind of general pattern, I think, which would be worth studying in the future. But as things stand at the moment, I mean, we carried out, or we analysed data from a very large national survey that looked at over 13,000 people. And actually, to be fair, we did find that most people, so certainly young people, the majority, about 9 out of 10 in fact, were actually drinking the same or less than they were before lockdown. And this is probably due to the fact that pubs and so on were closed, and this kind of reflects the way that many people drink, on a sort of weekly basis. But it's important to note that we did find that people between 30 and 50 years old, about 1 in 3 of them were drinking more. And actually, of those that were drinking more, about half of those were what we would call drinking hazardously. So that means drinking in excess of what the government daily guidelines are. And just to finish that point, we did find a small proportion, around 4 or 5%, what we would call dependent, based on clinical scales. So those would probably be the sort of people that might be showing themselves at Dr. Aspinall's clinic and at the hospitals and so on.
I know you're a lecturer and expert in neuroscience, so tracking how the brain is responding to all these stimulants. It just seems to me that there are many people who will look at the government guidelines and think, well, it's a guide, isn't it? It's a guide. I know people who will drink a bottle of wine a night in the week, no problem at all, and they'll say to me, that's not a problem.
I mean, it might not be a problem short term, but obviously the government guidelines are there for a reason, and they're based on the World Health Organization guidelines, which are based on data from many people over many years looking at the impact that alcohol has on the body. I mean, most people would accept that a small amount of alcohol can be beneficial to some extent, so especially certain types of wine that are high in antioxidants and things like that. But the problem is that habitually drinking a large amount, as Dr. Aspinall was saying in the last interview, this can have a kind of a cumulative effect on the liver over time, but also things like cancers and other illnesses as well. So sure. Drinking a lot regularly can have a long-term sort of deterioration of health rather than beneficial effects.
Dr. Matt Parker, thank you for joining us on the show, a senior lecturer in neuroscience at Portsmouth University, and both our experts there looking at the increase in people drinking, particularly those sort of bouncing around the 40 to 50 age group, drinking more but not going to hospital or seeking help.
Alan Newman at breakfast.
BBC Radio Solent.